people are actually using my complete mouth care system, improving their mouth health, and as a consequence, they are seeing a change in the surface color of their teeth. This debris on the surface of your teeth is not a stain. It doesn't disappear overnight. It isn't a magic pill that gets rid of plaque. Once it's been cleaned away, your tooth enamel will be hard, not porous. Just keep going. Tooth staining. Is it a bad thing or is it a good thing? I'm Dr. Ellie, and I'm here to explain the actual science of tooth staining. I don't want to even call it tooth staining because if you have a stained tooth, it would be a color that you couldn't get rid of. There are things you can grow up and be taking antibiotics at the time when your teeth are forming, and that really is a stain. It's something nobody can get out. You live with it for life. But what I see happening these days is people are actually using my complete mouth care system, improving their mouth health, and as a consequence, they are seeing a change in the surface color of their teeth. This they are calling a stain. I want to call it a surface coloration. If you drop something on the rug in your house, you have to work to get that stain out, and sometimes it doesn't come out. Well, this coloration, which is what I'm going to call this debris on the surface of your teeth, is not a stain. It is not within the enamel. It is not into the tooth in any way, shape, or form. This is something that has occurred, that has layered itself on the outside of your teeth. And the reason that this colored substance has landed on your teeth is probably because your mouth health has rapidly changed. You see, if you have habits before you began using my complete mouth care system, maybe you sipped water all day long, or you were drinking soda or sparkling waters that are very acidic, your teeth can have become porous. That means they have little holes in them. If you also tend to snack and sip and not use the mouth resting procedures that I teach, the problem is that your teeth, these porous teeth, will be the target of sticky plaque. And sticky plaque is going to be in your mouth for 6 months from the time you begin using xylitol. It doesn't disappear overnight. It isn't a magic pill that gets rid of plaque. It is something that feeds the good bacteria in your mouth. When you start using the Zellies, mints, and gum every day, you'll be feeding all the bacteria in your mouth. The good ones will multiply, and the harmful ones, the harmful plaque bacteria, absorb the xylitol, but because xylitol is a special pentose 5-carbon sugar, it cannot use, plaque cannot use it. It's the wrong shape of sugar. It's the opposite of regular sugar. And so what happens is this plaque that could be stuck to your teeth just basically becomes energy-less, doesn't reproduce, doesn't multiply, doesn't damage your teeth anymore because it's no longer producing acids. So your whole mouth health will start to improve, your teeth will start to feel shinier, you'll know your mouth health is improving because you'll feel these changes, but you might see this stuff that's still stuck on your teeth. Now, when I was teaching my own patients, the first thing I would do would be help them to strengthen their teeth and learn how to brush their teeth adequately. And here is the difference. One of the things you have to do when you start using my complete mouth care system is invest in a toothbrush that is going to deal with this surface coloration. Really, the only toothbrushes that I know that can do that are these mouth watcher toothbrushes that I recommend on my website. You can buy them in stores. You don't have to buy them from me. Then I have nothing to do with this company. They just make a very resilient, dense bristle head toothbrush that has the ability to get rid of this surface debris. You may have been told by your dentist that the only brush to get is a sonic or some kind of electric brush. This is not going to work. It is not adequate to get this debris off the surface of your teeth. So you have to make the switch. You also have to give your toothbrushes 24 hours in between use so they dry completely, otherwise they'll get too soft. The third thing you need to do is target. Actually target, go after these areas. You will see if you look closely, if you have a tooth that's kind of back a little bit or slightly twisted so it's harder to reach, these surface colors occur in the places that are hard to reach with your toothbrush. It's almost proof that that's the problem. And until you can learn how to target these areas, you may get this occurring. Now, you can help yourself by actually sprinkling a little crystalline xylitol. You can buy the crystals of xylitol and put a few crystals on your toothpaste when you're at the toothpaste stage of my complete mouth care system. And then with that more exfoliating toothpaste, really go after these particular areas where you're seeing the darker color. Now, another problem people have, because they're not my patients, is they may have been told that they were wearing their teeth away, brushing too hard, or they were wearing their enamel away or their gums away. You can't wear tooth enamel away with a toothbrush, not healthy tooth enamel, and not when you're brushing in the sequence of mouth care that I recommend, because the first mouth rinse actually gets rid of the acidity in your mouth so that you are not going to damage your enamel. You don't have to worry about that. And so be vigorous, go after those areas and you will brush them away. If really and truly you are unable to, I would wait about 6 months and then go and have a dental cleaning. Your hygienist will be able to brush those marks off your teeth so easily. And then underneath you're going to see this white, shiny, hard, wonderful enamel, because it doesn't interfere with the mineralization process at all. And once it's been cleaned away after 6 months, your saliva should have become clean so that you won't get this deposition anymore on your teeth. And your tooth enamel will be hard, not porous, so it won't allow things to get as easily stuck to the surface of your teeth. So it's this combination at the beginning that is the problem, and once you get off the ground, it should no longer be a problem. You don't have to do any of the sort of stepping back into the system or anything. Just keep going. Don't get thrown off the wagon by this unfortunate thing that you really can prevent if you get the right toothbrushes, brush vigorously, do all the things in the system, particularly mouth resting. That is, after you've cleaned your teeth, don't eat or drink anything for 1 to 2 hours. Same thing after you've had xylitol after lunch. Try to have a break. Try to give your mouth time for your own saliva to heal your mouth. That is the most important thing that you can possibly do to stop this staining happening. Now, I just want to mention that the plaque is going to stop forming, but while your gums are bleeding, if you still have plaque, that's another reason that you can get this surface coloration. It's just plaque that has the pigments from the bleeding gums, it gets into the plaque. It's another reason why you get this coloration on your teeth. Again, if you see your gums bleeding, the best treatment, the best thing you can do for bleeding gums is to brush them more, and to brush them with a little bit of xylitol on top of the toothpaste. And you should find within 48 hours that this bleeding stops when you really target with gum massage any areas of your gums that are bleeding. And then hopefully you'll enjoy nice, white, shiny teeth that stay, as people often refer when they write back to me after they're so pleased with the outcome, that their teeth really feel happy. Happy for the first time sometimes in their entire lives. So for more information about staining or my complete mouth care system, we have a lot of videos here on YouTube, or at my website I have a video boot camp where I can walk you through which brushes to use and my complete mouth care system.